They say that pain is the greatest motivator. And after 25 years of private practice in chiropractic, I tend to agree. Many patients, in fact, almost every patient that I've seen has come to me dealing with some sort of ache or pain or injury. And they may be taking pain medication over the counter or pharmaceuticals, or they've tried other therapies, and they're looking for a different answer, something that's a little bit more natural or safe for their body. You've heard the saying, if you always do what you've always done, you'll always get what you've always got. Well, if that's true, there's a prequel to that also that says, if you always think the way you've always thought, you'll always do what you've always done. And today I want to unpack a couple different ways to think about dealing with pain. And I want to do that through a case study. And this case study is going to illustrate some really kind of nuts and bolts application of how to treat pain differently. And then we're going to kind of zoom out and see a big picture, a different thought process about how we go about treating our whole health. Okay, so let's dive right in. I recently saw a new patient. She had been referred by another one of her friends who was a patient of mine. This woman had been suffering from some pretty intense acute lower back pain. She had had an episode like this about a year before, and at that point she was diagnosed with 2 lumbar disc herniations. She had gone to some physical therapy and done some treatment, and eventually her pain went away. And then about 2 weeks ago, she was doing some simple household chores, and she bent and twisted in one direction and was in excruciating pain and wasn't able to function. And so her friend referred her into my office. On her initial exam, it was clear that she had multiple pain sources, not just one. Multiple areas were causing and driving pain in her back. What was also really clear was that many of these issues had been going on for a long time. They were long-standing. Now, even though her pain only started a couple weeks before, the underlying issues had been there for a while, and we're going to come back to that in a minute. But on that first day, we incorporated a very different way of thinking than she had had in any of her other providers. So I did a very specific examination of her lower back, but I also did a thorough evaluation of her entire structural system because everything is connected. And once we understood all of the factors that were coming into play, then we were able to do a specific treatment to the right parts of the body. We did some soft tissue release of the muscles that were in spasm. I injected her lower back with ozone. We did some laser therapy, and we also did some kinesiotape. And I'm going to talk to you about all of those in a minute. And she returned a couple days later. She was absolutely amazed at how dramatic her pain relief was and just how quick it was. She revealed that some of her friends and family were a little skeptical of why she was going to the chiropractor in the first place. They figured that with herniated discs, she needed to be talking to a neurosurgeon or orthopedic surgeon. And so they were a little shocked when she was going to the chiropractor. But after they saw how quickly she responded, they were intrigued, and so was she. She's like, I don't know what you did last time. We did a lot. I kind of was just nodding my head when you were telling me what you were doing. Now I'm blown away. I want to know what was going on. So let me explain to you what I explained to her and why she was able to get such great results. So let's break this down. First of all, when we do an adjustment, many people think that chiropractors just kind of twist you into pretzels and snap, crackle, pop, and it's kind of this gross manipulative procedure, but not in our office. We take a very specific approach and use instruments to deliver specific amounts of force in the right areas at the right time in the right direction. So we did a very specific adjustment. And then we worked on the soft tissues around that area that were in spasm. Now, she told me she'd been to a massage therapist before, but it didn't have any results. Now, why would that be? Well, think about this. Muscles only contract when a nerve tells them to contract. There has to be a signal to the muscle in order for it to do anything. So we have to back up and say, well, where is that stimulus coming from? And in this case, and in many cases, it's coming from the actual joint capsule of the joint that's injured. So until we address that, there's no way to get the muscle just to calm down. Now, we can mash on it and massage it and try to make it relax, but if the reason that it's tight hasn't been addressed, it will come back. So after we adjust her, then we work on the soft tissue and it starts to respond. Okay, so next we addressed inflammation, and this is important. Most of us kind of have an idea that inflammation is bad and we should make it go away. And that's why we take anti-inflammatory medications. But the truth of the matter is that inflammation is a really critical component of repair. It's just that inflammation can kind of go wild sometimes, and it can also get stuck in a loop where it doesn't resolve. We kind of have an increase in inflammation, but it doesn't ever complete the cycle and resolve and repair the tissues. And so we approach inflammation a little bit differently. Instead of masking it, we want to amplify the reason behind the inflammation so that the body can go through this process quickly. So what did we do? In this case, I mentioned that we injected her lower back with some ozone. Now, this is not the same as cortisone, even though kind of the ending of it sounds the same. Ozone is a gas. It's what's in the atmosphere. So ozone gas is a stimulant that provokes a healing response in the body. But it happens to be almost 100% safe. There's very little that could ever go wrong injecting a tiny amount of ozone into the tissue. But it provokes even more dramatic healing response. And so what we did is we injected this lower back with ozone and some homeopathic remedies that help with inflammation. Second, we put her on a laser. Now, most people haven't experienced laser therapy, or what the scientists now call photobiomodulation. So it's the modulating of our biology by light. So our bodies are amazing receptors of light, and specific frequencies, particularly red and near infrared frequencies, have an incredible ability to penetrate deep into our cells and give our cells more energy. So if the cell has been damaged and it's trying to repair, giving those cells more energy to do that speeds this process up. And so science has proven that application of red light and near infrared into those tissues accelerates the healing response. So once again, not stopping inflammation, actually helping inflammation do its job. Okay? The other thing that's important in a state of inflammation is to keep circulation moving through an area. And so we applied a special type of tape called kinesio tape, or KT tape, and that KT tape lifted her skin just a tiny little bit, kind of creates some microcirculation and improves the drainage of lymph. And as the circulation is trying to move these damaged proteins and damaged cells out of the way, it accelerates that and facilitates that. Okay, now we also sent her home with some pain and inflammation modulating nutrients and herbs. Things like boswellia, turmeric, ginger, nutrients like resveratrol and quercetin, and even specific enzymes called serrapeptase and other protease enzymes. All of these are nutrients, and they're all combined in one formula that I love to use called inflammatone. And we provided this to the body and also gave her some extracts from fish oil called resolving mediators. Now, these are components of fish oil that are helpful to this inflammatory resolution. So now that's a whole lot better than just taking an ibuprofen, because we're not shutting down inflammation, we're using what the body wants to do and accelerating the repair process. So that was her take home from that day. And as I mentioned before, her response was phenomenal. I've come to expect 2 to 3 times faster healing for these sort of conditions when we start stacking and integrating and synergizing these different types of therapies, one on top of the other. And once again, this is a different way of thinking about acute injury and even chronic pain. So I mentioned there was one other big principle that I wanted to teach you about this case. I mentioned that this woman had had a similar episode 1 year before. And what did she do the year before? She did some therapy, and eventually the pain went away. And so she assumed that once the pain went away, the problem was resolved. But that is a dangerous thought process, because often symptoms are the last thing to show up and the first thing to go away in a disease process. And so by not addressing the root of the problem, those patterns of function in her body that had been set up long before that caused her back to hurt in the first place, by not getting to the root and addressing all of those, she set herself up for another episode. So as I sat and chatted with her, I said, hey, this is phenomenal that your body is repaired so quickly and it's on the way to repairing. What are we going to do to actually make sure you complete this cycle and create new patterns so that you don't end up with this problem again a year from now or even 6 months from now? So that's what I want you to think about. Many of us have lifestyle patterns that are contributing to poorer and poorer health over time. And it takes some sort of acute illness or a diagnosis sometimes to kind of wake us up and scare us into thinking a little differently. So here she was with this opportunity now. This acute injury, this acute flare-up of a problem was now a catalyst or an opportunity for her to really look at all the different pieces of the puzzle, to create new patterns of movement, to look at how she was setting up her office, her mattress and her pillow, her exercise regimen, her diet, and other factors of her lifestyle that were all contributing to this degenerative process that was going on. So as we zoom out and we start seeing all of the different pieces of this puzzle and start working on new patterns and new habits, now we're going to shift and change the trajectory of her entire health, not just the trajectory of her lower back. So there's sometimes little silver linings in the challenges that we face, and if we use these things correctly, it can be a pivot point that changes us and changes our entire health trajectory. So I just want you to chew on that for a little bit this week. If you're dealing with acute or chronic pain and you haven't addressed kind of this more synergistic or kind of stacked way of approaching therapies, well, we should chat. There may be some things that you can do right now that we can help you with to address your issues. But bigger than that, are there patterns of behavior in your life that you know are contributing to poor function and poor health? And how can we help you change those? If we can get to the root of these issues, we're going to prevent problems and actually build health over the long term. I hope that's something for you to consider today. Reach out and schedule a free discovery call with us. Go ahead and like and subscribe and follow us on all the socials. And until next time, be well.